A good day to all of you guys. So today I'm going to be presenting on a drug most of you are very familiar with, and I believe it's going to be easy for you to understand. So I'll be looking on panadol as my drug. So as I was doing my research, I managed to distinguish between paracetamol and panadol, and I found out that paracetamol is the generic name while panadol is the brand name, but we'll be talking about the same thing with the same existing characteristics and biological effect. So don't get confused, because as I'll be going through my slides, I'll be altering between paracetamol and panadol. Just bear in mind that I'll be referring to one thing since it means the same. Paracetamol is a commonly used medicine that can help treat pain and reduce a high temperature fever. It is typically used to relieve mild to moderate pain such as headaches, toothache, or sprains, and reduce fevers. So the mechanism action of panadol. Panadol works by blocking the synthesis of prostaglandins, primarily in the central nervous system, that let us know when we are in pain, and by affecting the chemical messengers that regulate our body temperature. It also blocks COX enzymes in the body. These are chemicals that promote pain, inflammation, and fever. The pharmacology of panadol, we've got the chemical nature, there it is. And also it is classified as an analgesic, which is the pain relief, and antipyretic, which decreases pain. So the routes of administration, we have got 3 of them. It is available for rectal, oral, and sometimes available for intravenous administration. Firstly, I'm going to be looking on oral administration. Orally, panadol can be administered as liquids, capsules, tablets, or chewable tablets through the mouth. It is the least expensive and the safest means which is commonly used. However, oral administration has a limitation that the drug passes through the intestinal wall and travels to the liver before being transported via the bloodstream to its target site. The intestinal wall and the liver chemical outer wishes to metabolize many drugs, decreasing the amount of drug reaching the bloodstream. Secondly, we have got rectal administration. In this form, a drug is mixed with a waxy substance that dissolves or liquefies after it is inserted into the rectum. Because the rectum wall is thin and its blood supply is rich, the drug is readily absorbed. It is normally prescribed for people who cannot take a drug orally because they have nausea, cannot swallow, or have restrictions on eating, as is required before and after many surgical operations. Lastly, we have got intravenous administration. A drug is delivered immediately to the bloodstream and tends to take more effect quickly than when given by any other route. A needle is inserted directly into the vein. A solution containing the drug may be given in a single dose or continuous infusion. So how it is used in the radiology department. Panadol or paracetamol has many uses in the radiology department. For instance, a patient can come straight from a fatal road traffic accident with a sprained ankle to be taken an X-ray scan. An analgesic drug can be administered to her or him to ease pain. Panadol is used also in hysterosalpingo contrast sonography. This procedure is mainly done to examine the cavity of the uterus and fallopian tube. A dye contrast material is injected through the tube and inserted through the vagina into the uterus. This scan is unlikely to be painful, but some ladies may experience period-type pains during and shortly after the scan. You are therefore advised to take an anti-inflammatory pain relief such as ibuprofen or paracetamol before the examination to ease up pain. Another instance where panadol is used is when radiofrequency neurotomy is done, and oftentimes patients experience pain and discomfort which can last up to 10 days after the procedure. This can be controlled by pain reliefs such as paracetamol. Radiofrequency neurotomy is a procedure used to alleviate, which is to relieve pain caused by arthritis, neuroma, degeneration, or following injury. Lastly, paracetamol can be used also in MRI scanning. Some patients experience discomfort during the scanning. Most patients are able to tolerate this without the need for painkillers. However, paracetamol can be taken before and after the scan to ease up pain. Thank you very much, guys, for listening. This marks the end of my